Hi, everybody, and welcome to this episode of White Coat Wednesday, Ophthalmology Edition. My name is Nicholas Reyes, but you can call me Nico, and I'm a fourth-year medical student here at UQ Oxner Clinical School, as well as the president of the Ophthalmology Student Interest Group. And I'm joined today by an amazing faculty member, Dr. Rachel Calix. She is a neuro-ophthalmologist here at Oxner and a previous graduate of this program. Thanks for joining us today.
Thank you for having me, Nico.
Of course. Well, let's just start off. And do you mind just telling us where you grew up, so your hometown, as well as went to undergrad?
Of course. So I grew up in the Carolinas, and I ended up doing my undergraduate degree in biology at the University of Oregon. That was before deciding to embark on this journey to UQ Oxner Clinical School for medical education.
That's great. So why did you choose UQ Oxner?
So I was looking for an opportunity in a program where I could really expand my horizons, both personally and professionally. And this really achieved that balance. Making the move to Brisbane was a really bold move in my life, and I think a lot of the students' lives. And living in Brisbane was just such a positive experience. It's a beautiful environment. And the Phase 1 curriculum, the clinical sciences, the basic sciences, I think really gave a comprehensive foundation for the medical education that we received. And in addition to that, I feel like early exposure to direct patient care in those first 2 years, which I think is something that's quite unique to this program, really benefits the students moving forward and really at all points in their careers. So that's really the education side of things. But I think on a personal note, I think this program really attracts a certain kind of person. And not only someone who's smart and ambitious, because medical students are like that, but people that are really brave and resilient. And I think it's just the perfect environment to make friends with really like-minded classmates, and I think we've all made some really lifelong connections because of that.
Yeah, as a student myself, I can totally agree with Dr. Calix. Mm-hmm. So how did you choose and select your specialty as a neuro-ophthalmologist?
So I had the opportunity during my clinical rotations in New Orleans to do electives in both neurology and ophthalmology, which were interests of mine for an interesting reason. Between finishing my undergraduate degree and starting UQ Oxner Clinical School, I worked for an eye bank in Oregon, basically procuring corneas and other eye tissues for transplant and research. And so that really got me interested in eyes structurally. And then later on, I found out all of the neurologic connections to the eyes, and I found that fascinating. So I had an interest in both right off the bat. And throughout my electives, during our clinical rotations, I had mentors, teachers that introduced me to the idea of neuro-ophthalmology and the fact that that was a specialty at all. And I said, you know what, I think that's perfect for me. And so I knew that that was something I wanted to pursue. And indeed, that's what I ended up doing.
Mm-hmm. So what is a typical day in a life of a neuro-ophthalmologist like?
So for myself, I really wanted to prioritize work-life balance. And so I'm in a unique position where I work part-time. I work 80% of the time. I have one day off a week where I can just be mom and really focus on my family. And then the other 4 days of the week, I come into the office and I start my cases. I see patients in clinic all day long. I don't do any surgeries, but I really just focus on the diagnostics and management of my patients with various neuro-ophthalmologic problems.
That's great. So you had briefly mentioned this earlier, but how did UQ Oxner help prepare you for your job?
So I think the phase 1 curriculum was really comprehensive in preparing us for the USMLE step tests. And then the clinical side of things, we're lucky here at Oxner to have a real breadth of subspecialties that can expose students to different ideas about what they might want to do in the future. So I think both sides really prepared me for just being successful in test taking and moving through these various hurdles that you go throughout medical education and training, but also just really finding what I love and what's going to be fulfilling. So both of those things.
Great. Let's see. Anything else that you'd like to highlight about your overall experience and just journey to where you are today?
I think we covered most of it, kind of the professional side of things, how prepared I felt, moving into patient care experiences was, I think, something that UQ Oxner students have an advantage in. And then also just the environment and the type of people that you work with, both your classmates and the teachers and mentors that are really supportive and nurturing.
Sounds great. Well, now that you've made it to the other side, any advice that you would like to give to anyone considering medicine?
I think a strong foundation in basic sciences is something that can be an advantage in terms of just a knowledge base. And then throughout the medical education side of things, having early exposure to the real life experience of doctors in different specialties. So not only showing up to clinic and learning the pathology that they deal with, but also listening to, like you asked about, what is your life like on a day-to-day basis? And really envisioning what you want your lifestyle to be like and making sure that you pick a specialty that's going to mesh well with that.
Sounds great. Well, that wraps it up for our ophthalmology edition of White Coat Wednesdays. I'm Nicholas Reyes, and you've just met our neuro-ophthalmologist, Dr. Rachel Calix. Thanks for joining us, and see you next time.